Welcome, ladies and gentlemen, to FOBtv, the future of business. Here, we explore the forces impacting tomorrow. I'm your host, Kevin Benedict. I'm a futurist and lecturer here at TCS. And today we're going to be talking about and exploring the future of healthcare. And the first person I thought about was my colleague on the Future of Business team, Adam Boostrom. Thanks for joining us, Adam.
Happy to be here, Kevin.
So you've been doing some work on healthcare, and I'm going to be doing this whole series of like 12 different articles in various aspects of healthcare. So I thought, let's just start with you. But before I ask you about the future of healthcare, where are you calling in from today?
Well, I'm in New Jersey, but just barely New Jersey, just across the river from New York City, just across the George Washington Bridge. I lived in New York for the last 5 years and then recently moved to the suburbs, as one does when they reach a certain age in life with multiple children. And I got to be honest, I think in my youth, I think I uttered the words, I will never live in New Jersey, at least once. But I'm actually really enjoying it here and all that suburbia entails. So
we have a small team. We have, 12 of us on the team. And how many live in New Jersey? Like 3 now?
At least 3, yeah.
So it can't be all that.
Going closer to the nucleus of where all the work gets done.
Well, except I'm here in Boise, Idaho today. And half the time I'm calling from a mountain cabin. Yeah, it's not the epicenter of a lot of things, just me. Okay, let's jump into this. You are a runner. You have run half marathons?
I've run several full marathons, including the New York City Marathon.
Yeah, I love it. So are you one of those guys that like measures all your stats?
I am not.
Okay.
I am one of those guys that says, I can't wait till this run is over. There are some people who run and they enjoy every aspect of it. They enjoy putting on their shoes. I envy those people. I really do. I run purely for the health benefits. My body feels better when I run regularly. I have fewer aches and pains. I sleep better. So running is like work I put in to get the benefits after. And sometimes it's a nice day out. I won't deny. I've gone through Central Park around the reservoir many a time, and it's lovely with the trees. But no, I don't. I'm just putting on music, putting on economist podcasts, listening to whatever I can to not focus on the running. I track absolutely nothing at all.
Now, at the gym the other day, I just paused for a moment and looked around at how many people were doing, all their watch stuff and taking, just all the wearables, and they were looking at their iPhone between every workout station and all of that. And I just thought, wow, that, there's a lot of work there. There's a lot of data that comes by and perhaps that's the future of healthcare. It seems like it should be at some level. But then last week I published an article where I interviewed an expert on saunas. They have no, measuring there. You just go in there in quiet, turn the lights off, and just sit there in the steam. So there's different ways of approaching healthcare today.
First of all, I would love to earn the title of sauna expert. Second of all, yeah, I agree. It's very complicated in terms of the benefits of really focusing on getting every last shred of fitness out, seeing am I at max heart rate? What is my VO2 max increasing? What's my heart rate volatility now? There's value in that, especially if you're trying to achieve elite athletic performances. I would never, if I were an Olympian, I think it's obligatory that you cover yourself in sensors. And if I were more sick than I am, thankfully I'm not, then I would work a lot harder to track my health measures because data is useful. That's why AIs are so powerful, because they have so much data, their lifeblood, and they're able to turn it into useful insights. So it really depends on what you're trying to get out of it. I'm trying to get just like a basic level of fitness.
Got it.
But if I were ever wanting more,
pro level aspirations coming from Adam.
Sadly, I think those have passed.
So you're a father, you have children, you have a family, you live in New Jersey. How has AI impacted your family's approach toward healthcare?
Okay, well, I think a lot of the stuff, being that I'm a futurist on our team, I'm more interested in all of the things AI will do than what it's currently doing, because what it's currently doing is honestly not that interesting. Like how AI impacts my family right now is that it's our go-to whenever a malady pops up. Okay, child has these symptoms, they're puking, it's this color. And do I need to worry? Do I need to contact poison control? The answer is no. But AI is the first go-to where there used to be telemedicine, or you might try to get a doctor on the phone, or you call your primary care physician or whatever. AI is now the first go-to to tell you, should I worry about this or should I not? And that's how it's impacted us in practice. But I think that the promise of AI is far beyond that, and I look forward to that.
So where do you expect AI to deliver the biggest value in the future?
So I take questions like this very literally. So I'm going to give a very literal answer. The biggest value, AI is going to make everything better. It's going to make new things appear. It's going to make everything cheaper. You look at how much AI can produce. You look at high quality video deepfakes. Yep. They used to take many hours of work, and now I can go ask my computer to take any famous individual and have them say any line I want them to say, and it's seconds.
Yeah.
So AI is very good at producing things cheaply, and because of that, it's going to make everything better. So the question of where's it going to deliver the most value is really a question of what is the biggest market, has the biggest potential, because if it improves everything, then whatever's worth the most is what it's going to get the most value from. Yep. And I think that that's going to be drug development. If you look at the huge drug development companies, billion-dollar entities, and anytime there's a new drug that comes out, the market share for it is huge. The potential there for AI to search through all the data, if you look at what Google is doing with protein folding,
yep,
their ability to predict how DNA sequences are going to turn into certain shapes that will have certain effects on the cells within your body offers an almost unlimited potential for medical breakthroughs. And it's just a matter of time before we discover drugs or proteins or DNA genetic splicing that results in better health outcomes. So the pharmaceuticals would be my one-word answer. So
this week, I was listening to a podcast, I think on Freakonomics, on the fact that when you try to create a new drug for some ailment, it on average takes 15 years to go through all of the approval, the testing and all of the processes. So if you started today, 15 years from now. In addition to that, it costs billions on average for any pill. So if you solve something that nobody's willing to pay for, but everybody needs, you can't even develop it because you can't get a return on investment. Mm-hmm. So a lot of these companies, startups out there, are wanting to find existing drugs that have new benefits for other things. And so they can use AI for that, and they can skip most of that 15 years of approval process, because often the drug that they rediscover, if you would, has already been through that 15 years. So it's already been approved in a lot of different contexts. And so you're just applying it to a new area. So that's a huge push right now by the kind of the startup community. That makes a lot of sense, of course. That's what happened with semaglutides. Yeah. GLP-1s, which were a drug for diabetics. And then surprise,
They actually are the miracle weight loss drug people have been looking for forever.
For now, and all kinds of potential addictions in addition to food. Yeah, drinking, drugs, all kinds of potential stuff out there. Wow. So where do you think automation will have the most impact in healthcare?
So automation is about doing repetitive processes better, cheaper, faster, with fewer issues. And what are the repetitive processes that occur in healthcare? Surgeries come to mind. If you can imagine, obviously, some surgeries are very complicated and humans are going to be required to be in the loop for a long time. But some surgeries are not. I've never had a hernia mesh, for instance, but to my knowledge, it's a pretty basic process that one is like the other. And you can imagine a machine that does this instead of a human that cuts people open and sews them up, snip, snap. And this will reduce costs and increase availability and can be used for all kinds of surgeries. And I think automation will definitely impact people going under the knife.
Oh, absolutely. Matter of fact, over the last 6 weeks, I've probably been on the phone 8 hours with the same company. A simple, basically asthma-related medicine that is very effective, yet who pays for it is spread out over so many different organizations. It's your insurance will pay a little bit of it, but there's a copay plan from the medicine manufacturer where they help pay for some. Anyway, it's layer after layer after layer of financial involvement just to get a simple asthma medicine. So when I think about automation, my head went straight to, they just have to fix the processes for this stuff. This is all logic. This is all math.
Those approval processes. That's not a technical problem like surgery, like having the know-how where to put the hands. That's a political problem.
But
so I'm not sure. So long as there are all these competing groups, your PBMs and your healthcare providers and the insurers all having complicated relationships with one another, sometimes being the same person, they're going to be approvals and people are going to play games like you pay for this, you pay for that. I know exactly what you're talking about. I have asthma and at different times have taken medication for it. And I recently, a couple of years ago, I had so much difficulty getting a prescription approved. I just didn't do it. And my breathing is slightly worse as a result, but it's easier than I went to 4 or 5 different pharmacies and they just could not get it figured out. And they kept telling me to go back to the other one that I had just come from. It was insane.
Well, that's why when I was thinking of automation, my head went a different direction. I'm like, just make the complexity in the background disappear. If you just let that disappear from me, I would be happy.
Yeah. Yeah. Well, healthcare, many of us have negative experiences with it. I would love nothing more. Yeah. If we could get those issues cleared up, but that's not a technical problem. It's not that we don't know how to get prescriptions transferred by email or by API from one location to another. It's that these different agents are wrangling over who's going to pay what.
Yeah.
And you're able, when you're a super huge company with millions of people, tens of millions, hundreds of millions, you're able to save enormous amounts of money if you just reject like 5% or whatever. And the result is that we all have to jump through all these extra hoops. But that's because of the system that's in place. And AI is not going to help that. Politicians.
I agree with you that
have to help that.
Yeah, that foundationally that won't change anything. But if they can just make it disappear from me, I would be happy with that.
I'd be thrilled. Yeah.
Yes. So let's talk about precision and personalized medicine, Adam. How do you think AI is really going to contribute there and support the whole notion of precision and personalized medicine?
Well, it goes back to data and what we were talking about earlier with drug development.
Yeah.
So to develop a drug, you need to understand, countless interactions, countless bodily interactions. How will this affect this person's endocrine system, their respiratory system, their digestive system? And it's made more complicated by the fact that every human is very slightly unique.
Yeah.
Sometimes not so slightly unique. And every body is different and responds to treatments and drugs and interventions in different ways. And the result of this is that a lot of drugs can't be tried on people because there's a chance that there will be a negative outcome.
Mm-hmm.
But with personalized medicine, you can know, if you're able to take enough data about an individual, that you can know for sure they will respond positively to this, not positively to that, then suddenly you open up so many faster, better treatment options. So yeah, I'm looking forward to that benefiting us all.
Oh, yeah. And that's where I can really see the value of the wearables, right? To really collect what makes you unique. How does your body respond differently? All that kind of stuff. Wow. So how could AI and automation help support and improve clinician judgment and decision making? Our daughter is right now in grad school to be a nurse practitioner, and the amount of stuff she has to memorize, come up with when she's working with a patient is just massive. The amount of, you can think about a doctor goes to medical school and then they go out and practice. But if they've been out of school for 10, 15, 20 years to remember everything, that's such a huge challenge. It just seems like AI is going to increasingly just tap you on the shoulder and say, you know what? It seems like these three things here would be the first place I would look at. Because they can look at that data and instantly just help you zero in. And even though that's not an area of your specialty, perhaps, or you just don't see a lot of it, and if it could tap you on the shoulder and just remind you to look here, boy, I could just see some advantages there. Absolutely. So what parts of clinicians' work drain the most energy without improving patient outcomes? When you look at the process, what do you think exhausts the medical personnel more than anything else?
Well, there's a lot in the culture about note-taking. So, for instance, the popular show The Pit, its second season focuses on AI reducing note-taking and points out that doctors spend more time doing paperwork, sitting at a computer, than they actually do treating patients. That being said, I think the bigger drain is the battery of tests in search of a proper diagnosis. So there's so much, when you go to the hospital with an issue, almost always that issue is not really understood, maybe even for a long time. Mm-hmm. And they'll say, well, let's give you a CAT scan, let's draw blood, let's test for this, let's test for that. And if the issue were known faster, if AI were able to make better diagnoses, and if wearables could verify the whatever ailment you're having sooner, then you could reduce so much of the what is essentially unnecessary testing, which will reduce a lot of cost and a lot of grief. And then that adds to patients complaining and saying they fight back. I don't want this test. I don't want the cost. I don't want the experience. And I think, I'm not a clinician, but I would think that that's actually going to be the thing that saves them the most hassle.
Oh, yeah. And all these challenges and complexities, I think, almost force patients to go out and start self-diagnosing. And the more complexity there is and the more challenges and the more cost associated with it, I think more and more people will look for a cost-effective alternative by going straight to AI themselves on their own iPhone. And try to already happening. You're absolutely right. So we talk a lot about digital twins, whenever we talk about the future of just about anything, digital twins is a critical component of that. And for those that aren't familiar, of course, digital twins is basically a virtual representation of a physical object. So if you're wearing wearables and it's giving you data, well, then you can use that data to say, okay, here's what I know about Kevin. Here's a digital twin. I know his pulse rate. I know his blood pressure. I know all these things. So now we can create a digital twin of him based on data that comes in. So based upon that, how do you think digital twins are going to play even a more important role in healthcare in the future? Where do you see it going?
Well, it's kind of what we were just talking about, where cheap, effective digital twins are going to allow people to not just diagnose themselves, but to dry run treatments for themselves. So if you imagine a digital twin as like a simulator, like if you're a major airplane manufacturer or airline, you have a flight simulator, this big box that people can go in that has all the screens and images. And when you pull up on the yoke in that simulator, everything responds as if the airplane were actually increasing in altitude. And from that, you're able to test, okay, if I lose this engine, will I crash? How much do I slow? And everything will be exactly as it would be if you were in a real plane. Flight simulators are great, but they're huge, they're expensive. Not that many people have access to them. The promise of digital twins and AI is the idea that everyone could have their own flight simulator for themselves. Sort of an analogy I want to use that may not hit for a lot of your audience. I used to I played a lot of video games when I was young, and I used to love Gran Turismo, the car racing simulator. And if you can imagine something like Gran Turismo for your own self in your own home that you can pull up at any time, that simulator of car racing is so precise that amateurs that have never been in a race car are able to say, well, you're slightly faster around this turn if you take this line instead of this other line, because the simulator is that precise. And so the analogy would be if I have a digital twin of my own self at home, I could try 100 different drug treatments and regimens and surgeries or whatever, and then I could see, all right, my digital twin performs best with these 5 treatments. And then I could take that to my doctor or healthcare professional and say, I think we should pursue these. And the result will be better, cheaper outcomes for everyone.
Oh, I could just see the doctor going, no, not another digital twin guy. I have different possible.
If they're a good doctor, they will be grateful for it.
Yeah.
If the digital twin is good, if the digital twins are producing spurious results, that's another issue.
Yeah.
I'm assuming that the technology works as intended. It's hard to make. I guess we should point out, it's very hard to make a digital twin of a human, because a human is composed of how many trillions of cells?
Yes.
So it's the complexity there is much more than just a big metal plane in the sky.
Yeah.
But assuming advances in computing continue, I don't see any reason why at some point human digital twins are a thing. And I'm thinking, as I'm talking, I'm thinking of a quote I love from economics, the field of economics, which is that all models are wrong, some are useful.
Yes.
Which is this idea that any model that tries to represent society is going to be incomplete, and there are going to be exceptions and caveats, but that doesn't mean that you can't learn things from it. So even if your digital twin is faulty or not imprecise in certain ways, there's still a lot of value to be had in running simulations and coming out. That's why I said you come up with a top 5 instead of a top 1, because maybe 4 of those don't work, but if one of them does, you're set.
Absolutely. So kind of circling back to our idea of wearables and sensors and digital twins, how do you think continuous or always on care will be impacted by these wearables and sensors? I'm thinking even in the context of elder care, where you have elderly people that want to stay at home longer. They don't want to be in assisted living. They want to stay in their familiar surroundings. So how do you see the sensors, digital twins, wearables playing a bigger role in that space?
Well, you mentioned elder care, which is sort of like setting up the question for a volleyball spike. Like that's the obvious answer is that people are going to be allowed to stay in their homes, because previously it was too dangerous to leave someone unattended. They couldn't be allowed to be on their own. But now, if monitors are always watching someone, you can leave them where they want to be and bring care to them only when they need it. So assuming they don't need constant care and constant interventions, then people should be able to continue to live independently. But I want to point out, just as we were talking earlier about runners, everyone is going to benefit from digital wearables because data is power.
Yeah.
When you look at every company that's ever existed, the ones that are able to collect the most useful data, like what made Walmart so successful? They had better inventory management than anyone else in the 90s. And they were able to track where supplies needed to go before they even needed to get there. And that was because they had the data on what was being sold, when, to who, in what circumstances. And it's not going to be any different with humans and all the different health outcomes that they want to achieve. Data is going to help them achieve those better.
Got it. Let's now talk about robots, Adam.
Okay.
What role do you really see having the most impact when you introduce physical robots into healthcare services? Where do you see the impact and influence there?
Well, first I want to say I'm a huge robot fan. I think that physically embodied AI is going to be wonderful. It's going to usher in a golden age. Every night when I'm doing the dishes, I think I look forward to when there's a robot doing this for me. Anyway, elder care is an obvious answer. So if we're talking about people who want to live independently, it's way too expensive to hire a full-time care nurse, especially people that need low stakes, constant physical intervention. So if you need help getting to the bathroom every 30 minutes or every 3 hours, and maybe drink a lot of water, and you can do everything else on your own, but you just need the physical assistance of getting from one place to another place periodically. In the past, you would have to be in a hospital or be in a full-time care facility for this, even though you don't need care most of the time, and even though the issues you're having are not complicated or life-threatening. But now, robots are going to be able to assist with routine, low-stakes physical labor, and it's going to allow people to live in places where they couldn't live before, to live independently, but it's also going to free up a lot of time for everyone to work on more high-value tasks. Mm-hmm. So let's bring on the robots.
In my family, we have a number of healthcare professionals and nurses, and just to hear their stories about having to help a 500-pound person out of bed to go in and shower, or to go to the restroom, or to just roll over, or, all these different things. And it's so dangerous for the healthcare professionals to be in those kind of environments where you're expected to work with immense amount of weights and jeopardize your own health for that. And so I look at it from a very personal perspective, my family members, give them the tools to lift, help, support, move, restrain patients needed, all of those things. So you're not leaving, a couple nurses in the middle of the night to take care of some violent monster, that's been brought in by the police and put into the bed and given over to nursing care. So I look at things like that too and say, oh man, come on guys, give us help. Give our healthcare professionals help here so they're not jeopardizing their own lives and livelihood every day, just trying to support the community.
Yeah, well, yes. Even another issue that comes up a lot with healthcare is the nursing shortage. And to even just have several robots around that free up nurses for safer, higher value tasks is going to make a big difference.
Oh, yeah. So let's talk about economics. You've brought that up a couple of times. I know that's a personal area of personal background and interest of you. So let's talk about that. Who financially wins and who financially loses when AI and automation is brought into a healthcare environment? Who are the winners and who are the losers?
So AI is going to reduce the cost and increase the supply of really high quality healthcare. That means the winners are going to be the consumers. So that's basically everyone. At some point in their lives, that's everyone.
Yeah.
We're all going to be the winners, which is great. We're going to get better care, cheaper, and I'm looking forward to it.
Yeah.
The losers are going to be the producers who don't adapt. So if you are a drug manufacturer, if you are a hospital, if you are a surgeon that specializes in a very rare, expensive kind of surgery that until now you're the only person in the world who could do it, but now there may be a robot who could do it as well. That competition is going to drive down costs for what you're able to charge for your services.
Mm-hmm.
Now, this doesn't mean that I'm, like you take the drug manufacturers, this doesn't mean I'm betting against them. Mm-hmm. Pfizer and Eli Lilly and GlaxoSmithKline and Novartis have, and all the others, have huge advantages already in place. They have very large, successful businesses and research teams and financial capital at their disposal. So they can eat up incumbents, not incumbents, they can eat up those who would disrupt them. They can acquire other companies and stay on top. I'm not betting against them and saying that they will be losers. But if they don't adapt, if they're not aware that new companies are going to be coming and are going to threaten to disrupt them and that they need to use AI themselves to make their processes more efficient, then they will be the losers. And probably some large companies, some large hospitals are going to go out of business. Just because that's always what happens in the course of economics.
Yeah. So why do technologies that clearly improve care often struggle to scale across healthcare systems?
Because of the systems that are in place. Because of the incentives. The incentives are not properly aligned. So I purchase healthcare through our company, probably the same as you. Mm-hmm. And that healthcare company is not really incentivized for me to get better or worse care. Like when I go to the doctor doesn't get more money if I'm cured and less money if I'm not cured. And my health insurer doesn't pay out more or pay out less. So we have a system that's set in place now where people are paying for care, but they're not paying for outcomes. And because of this, the incentives are not aligned to reward people who initiate processes that produce better outcomes. And until those incentives are switched, we're going to keep having major difficulties because the people who work at all the companies in the healthcare chain, the providers and the insurers and all the rest, they are humans who are responsible to their shareholders, who have to maximize company value, and within the rules that are currently in place, the systems that are in place, that means denying care and not making things, sometimes denying care and making healthcare decisions that are maybe not in everyone's best interest, unfortunately.
Absolutely. I was talking to a healthcare professional the other day who was just talking about incentives and saying there's so many things that are effective treatments, but they don't require you to come into the clinic or come into the hospital.
Exactly.
People do it at home. They could do it themselves. So there's no incentive for the healthcare providers to be using those because that means less income, less visits, less everything for them. So again, the incentives are all messed up. One other trend that I just wanted to bring up, kind of our final topic to bring up, Adam, today, is that one of the biggest trends on social media today are people that are doing these kind of self-diagnosis and self-treatments for everything from beauty to physical fitness to everything. And it's like that's one of the biggest trends out there in social media is how to use AI and everything to give yourself injections of things that have not been approved or designed for that particular use. But are you seeing that? Because within the 20-somethings and 30-somethings, I'm seeing huge amounts of mail order product that people are just having delivered to their house and self-medicating.
I'm not seeing it because I don't live in other people's homes, but I'm aware that it's happening. It doesn't, I don't know, I take a very big picture view of population trends. which is to say, you take 100 people, 10 of them are never, ever going to try anything new. They're going to, maybe they only drink honey water when they're sick. And they're not going to take any vaccines, and they're going to that's what they're going to do. And 5 or 10 people are going to try everything, and they're going to take any new pill that comes along. And the other 80 or so people are going to be somewhere in the middle. But I guess what I want to say is, I don't think it's a new trend that people are taking chances to try to get better outcomes. That's what humans have always done. That's what makes humanity so successful as a species. And some percentage of those risk takers are going to, like Christopher Columbus.
Yeah.
He sails off into the unknown. 95 people are not going to make that trip because they know he's going to die at sea. And yet it opens up the new world to the old world, and so much follows from it. Obviously not all of it good. But this idea that some people take what are objectively stupid risks, but they pay off. And because of this, some percentage of humans are always going to do this, and some percentage of those are going to be glad that they did. So I don't know. I think this is pretty normal for us.
Got it. Adam, I love it. I love our conversation. It's fascinating as always. Thank you for joining our program today.
Happy to be here. Thanks, Kevin.